Ashley's gonna start. Okay, good evening, everyone. It's 6:40 p.m. So I'm calling the Health and Environment Committee to order. We have a number of people here at the district office, and we have right now 10 or 11 on the Zoom. So, yeah, it's always larger because of our space limitations. So thank you all for coming, and always thank you for your patience. And let's see, and this is mine here. So, we do have a quorum now. So with Heather Jason, Monique Hardin Cordero, and Laquita Henry. We, as mentioned, Michael Iglesias graduated law school and he's off to another state, where he'll get a wonderful job. Liz asked to be excused because of her work schedule tonight, Liz Eastman. And I believe that's it. There's only one person I did not hear from. So, but we're good to go. Thank you all. Do you have in front of you the agenda? What I need people to do is look at the agenda, and the agenda is not nearly as long as it looks. As I mentioned to our guest here, I always have the resolutions uh, included because so much is going on and we need to have the community see, as well as our members, what we've worked on, how busy we've been over the last couple of years, and how accountable we've been to our community. And we pass this along to our legislators and department heads in the city, hoping that and also knowing that we have to push if they haven't acted on some of the issues we deem critical for our district. But the agenda itself is actually a page and a third. So if there's anything to add, uh, can we do that now? And I know we have one ad. Pauline Ferranti is there, and you sent me a note, Pauline, but I didn't have complete names and positions. So if just mention what you're recommending that we add.
Sure. So I will stay until the end of the meeting. So in my place for the updates, I have Georgia Kingsley and Denise Young Farrell from the Department of Health to give everyone a overview of Healthy NYC.
Okay, thank you, Pauline. Any other, that will be item 4. Any other additions to the agenda that should be added? Okay, so can I get a motion to approve the agenda as amended?
I move to accept the agenda barring any edits. I didn't say that loud enough, sorry. I move to adopt the agenda barring any major edits.
Okay. That was Monique Hardin Cordero. Approving the minutes of the agenda as added or amended. Is there a second? Heather? That would be on you. Thank you. And properly seconded by Heather Jason. Okay. So we have about that's our district manager back there saying busy. We have 4 items for the agenda, and I actually think there's a possible 5th. So starting right now, we should be able to still get out. We will make it a point of getting out on time. Let's move in terms of the minutes, the committee members have the quick recap done by AI. Very frankly, with the additional committee work with the elections and all for the community board, I really forgot about this until today. So, but what we can do, I'll have time to work on it tomorrow and add in what we need to add in. So if you like, from a committee standpoint, we can vote to approve with corrections as they come up, and I can email it to everybody, and then I could call. What'd you say? Yeah, it's just, this has been crazy. So, okay, so can I get a motion then? Maybe Heather, you
Yes, I motion to
Uh,
accept, yeah.
and then
Decisions.
with corrections, okay?
And a
So,
second,
so Edwin, if you heard that, Heather moved to accept the minutes as presented by AI, but knowing that we will have corrections, and I will get
Oh.
it to the committee members.
Yeah, like I don't, the Phantom wasn't let in, but you know, like I said, somebody there said that they are doing it through the AI, so
Oh,
what happened?
I'm sorry.
he still thinks it's being.
Phantom was not let in to do the recording, but you know, you guys are doing it with the AI there.
I suppose.
We switched to a new, the
They
government format, that's what messed.
They
us up.
switched to some new government program, so it's something that. there
Oh,
is
okay,
some-
yeah. So they'll send it.
I don't know all the details on the technical aspects of it. Okay, Edward, but stay tuned,
So we can
okay?
get our regular transcript.
And so, yeah, we'll get, but what did you
We
add,
get a
Heather?
Regular transcript for last month's meeting that we normally do. So-
Yeah, something's going on, so we'll work through the kinks. Okay, moving forward, under announcements, our key liaison is New York City Department of Health and Mental Health. I know Cheyenne Murillo had something that she sent to me by email. What I will do is get out that information to everyone. Let me just see. But you'll get it. I'll forward it to you. Cheyenne's department is different from that of our usual liaison, Pauline Ferrante. So as with other meetings, I've gotten out, passed along information. So just look for it. Hopefully I can do that tomorrow. Maybe even tonight. Okay. That's the only announcement I have right now. Just quickly, Monique, I know that the cannabis, we have a task force on cannabis that's had a 5-week series. Can you just announce something just very briefly about what that was, when it took place, and
So it was a cannabis workforce initiative, and the point of that initiative was to basically provide information around this space, cannabis space. It's still burgeoning, there's something new that happens every day, every minute. And what the 5-week series, which ended actually last week, Wednesday, just focused on different aspects. So certainly people who are interested in opening a dispensary got some feedback and tips and such, but we try to focus on other areas in terms of the ancillary opportunities that are associated with the business and the industry. So each week that we met covered a different topic.
Mhm.
And we'll be probably writing up something very briefly, just to let people know the areas that were covered. And a certificate was earned from participating in those 5 weeks, and then additional opportunities will be available online. And I will add that we are ending this month, as we end or wrap up the community board work for the year. On Saturday, June 28th, we're doing a cannabis event, an education event that's geared towards young people. Once again, the theme is to focus on opportunities such as educational opportunities. There are a few schools now throughout downstate that offer certificates and degrees around cannabis, depending on what your interests are. And so we want to make sure young people over 21 are aware of those opportunities. as well as other things going on in the space. So that'll be happening at the forum, down the block at Columbia. And we're wrapping up and finalizing those details, and we'll be sharing more. Ashley has been kind enough to be helping us with the, pulling together the marketing and doing the outreach. So you'll be seeing more information shortly. So those are the updates.
Okay. And Ashley, Tapia is our, district associate working in the office, and she's been with us, about a month now, month and a half. So you'll be seeing Ashley's name on a lot of, documentation. Also, Columbia University Irving Medical Center hosted a research forum where, several of their doctors presented particularly specifically on cancer research. And so that was informative. They'll be sending us a number of slides from the presentations that were, pretty in depth actually. And we'll be able to have them on our website and share them, and we'll make an announcement when they become available.
Can I?
Mhm.
Yeah, I would just add, the emphasis was on cancer clinical trials and trying to increase awareness, especially in our community, since there is a lack of diversity when it comes to clinical trial participation. So by us sharing it on our website, it allows greater access to those who we are engaging with to share the information and just, improve the health and outcomes in our community when it comes to cancer. So I wanted just to stress that.
All right. So moving forward, we'll now hear, I'm gonna have, Pauline, you introduce, the two colleagues again from, New York Department of Health and Mental Health. Pauline Ferrante, Pauline, give your department again, and, then introduce the other
Sure.
two. Do you need, to be made a co-host?
I think we're able to share screen, but let me just check. Yes, I think so. I think Georgia's ready to share the screen.
Yep, I can go ahead if it's the right moment.
Yes, definitely. Thank you.
Okay, let's see. As long as I have.
You want me to share my screen?
Yeah, I think you don't have to do anything. You might not have to do anything.
Oh, do I have to make you a co-host to do that?
No, I can share from here.
Oh,
Did it already?
great.
Okay.
New technology. Okay,
Can you see this?
No.
no.
Wait, hold on. Can you see can you see that? Wait, hold on.
It's coming. There, we can see that.
Okay.
Introduce yourself.
Hi, everyone.
Hi.
Should I get started?
Yes, but everyone should, still know who's speaking and for our recording.
Okay, hi, I'm Georgia Kinsley. I work in the Commissioner's Office at the New York City Department of Health and Mental Hygiene. And I'm also here with Denise Young-Farrell, who can go ahead and introduce herself.
Hi, everyone. I'm Denise Young-Farrell. I work alongside Georgia in the Commissioner's Office on Healthy NYC.
Welcome.
Thank you for having us, and thank you to Pauline for facilitating our presentation here today. So I'm going to go through a couple of slides talking about Healthy NYC, and Denise is going to also present a few slides, and then we're happy to open it up to any questions you may have. So I'll go ahead and get started. So Healthy NYC is really a response to what we saw coming out of the worst of COVID. So If you see on the graph here, we obviously knew that COVID would have quite a stark impact on life expectancy, and it unfortunately did. And that difference was felt, sorry, not the difference, the impact on life expectancy was felt very inequitably. So you'll see here that life expectancy for Black New Yorkers fell by 5.5 years, and life expectancy for Hispanic and Latino New Yorkers fell by 6 years. And you'll see that in 2021, it did jump back up a little bit, but it doesn't mean that a full rebound to where we were pre-COVID is inevitable. And that's really because we were seeing a plateau of life expectancy prior to COVID. And as you can imagine, with issues like chronic disease, like diabetes and other cardiometabolic diseases and overdose, all of those things were not necessarily going in the right direction before COVID. Those were plateauing, or they were just very hard to move the needle on issues. So coming out of COVID in early 2023, we were looking at this data and we thought to ourselves, okay, what is our response to this? What is the action we should be taking as the health department, as the city strategist, to respond to this? And so what we came up with is Healthy NYC. And this is a citywide strategy to improve the health of our over 8.5 million New Yorkers. We took about 8 months to work through all of the details and really come to a consensus on what our goals were going to be. As you can imagine, that was a very difficult process with a lot of different thoughts and feelings and opinions. And so we were really proud that we took the time to think really closely about sorry, my brain is a little fuzzy right now, think very clearly about what our goals were going to be. And so we officially launched in November of 2023. And this is a set of ambitious citywide goals to increase life expectancy by targeting the major drivers of overall risk, premature death, and also extreme racial and social inequities. And we also have a few cross-cutting factors like community, social, and structural factors, climate change, and access to and quality of healthcare that we are really taking into consideration when we think about what our strategy is. So we always call those out. So to get to the actual meat of what Healthy NYC is, it's an overarching goal of reaching at least 83 years of life expectancy by 2030. And that is going to be achieved by accomplishing these specific 7 goals. And so we looked at our vital records. As the health department, we manage all the birth and death records in New York City. And we looked at what the top drivers of loss of life expectancy were. So these goals represent about 50% of all deaths in New York City. And all of the other causes of deaths are much smaller or are issue areas where we as the health department do not have jurisdiction over. So as you'll see, we have drug overdose, suicide, cardiovascular diseases and diabetes, screenable cancers, COVID-19, violence, and maternal mortality. And I'll just take a second to note that obviously with COVID, this was a goal set when the data we were looking at was showing us that COVID mortality was still a huge issue. And we are very thankful that COVID mortality has gone down significantly, but it still at the time represented a huge cause of death. So we will be keeping that for the next few years as that mortality continues to go down. And then in terms of maternal mortality, you'll note that this is the only goal that we call out a specific racial or ethnic group. And that's because while maternal mortality does not represent one of the top causes of death, it is such an extreme inequity that we felt it was necessary to reference it as one of our major goals. So how are we going to get there? I think this slide is really helpful because it's important to note that it's not just about measures to reduce overall mortality. We really need to focus on the places and people who are dying prematurely. And that is typically Black and Latino New Yorkers. And so, as you may recall, during the Bloomberg administration, we actually raised life expectancy in New York City by about 3 years over his 12-year term. And that was really due to a lot of population level intervention. So if you think about like sugary drinks, nutrition, trans fats, tobacco control. That was all really high level, like policy level interventions. And we also wanted in this approach to focus on excess mortality and premature mortality. So thinking about people who are living in high risk settings, and really equity focused interventions that, you know, invest in communities. And so we are really taking an equity focused approach to how we're planning to accomplish Healthy NYC. We also knew that any population health agenda, you know, commissioners, mayors come and go. We wanted to make sure that this was a sustainable initiative. And so we were delighted that City Council actually passed a law in parallel with the announcement of Healthy NYC that required the creation of a citywide population health agenda. And that essentially requires us to report out on an annual basis and also revisit the goals every 5 years. So we really see this as our accountability mechanism and the way that we plan to show the city how we're going to actually reach our goals. We break down Healthy NYC into these 3 main pillars. So we have the campaign, which is about spreading awareness, making sure people know that Healthy NYC exists and that, you know, the city is thinking about their health and well-being. And this takes the form of a variety of different things. So we have you know, events. We have a Healthy NYC Champion initiative where partners can sign on, and we'll talk a little bit more about that. But this is really about like overall getting the word out. Then on the programmatic front, we have done a lot to align ourselves internally and externally around Healthy NYC and these 7 goals, which we'll also talk about in a second. And then more broadly, we're thinking about how we can drive investment, you know, more upstream and what we can be doing to ensure we're investing in the social determinants of health. And all of this is, of course, underpinned by a strong and integrated data system. And so we have launched what we call the Center for Population Health Data Science, which is, excuse me, a way that we are thinking about how to more efficiently and effectively, you know, integrate all of the many data sources that we have. And then, of course, we are consistently taking a health and social equity approach across all Healthy NYC goals. So we're going to talk a little bit more about the first 2 pillars, and then we'll open it up to questions. So on the campaign front, we launched this Healthy NYC Champion model about a year ago, which allows partners to formally sign on to the goals. And my colleague Denise will talk about that in a second, but we were really excited to launch that. We also had a PSA and a media campaign to engage the wider public. We also held a symposium in November to release some of our data from 2022, and we're going to be releasing our 2023 data in a couple of weeks. And I'll turn it to Denise to talk a little bit about stakeholder engagement.
So as Georgia mentioned, we set some pretty big, ambitious goals for Healthy NYC. And yes, this is the work of the health department, but it really is a citywide initiative. It's really, you know, we rely on partnerships and commitments from a number of organizations across the city. So this is anywhere from, as mentioned, you know, City Council has made this a law, so we're working with elected officials, working with community-based organizations who are working on the front lines and working in different neighborhoods across the city, across the boroughs, academic institutions, faith leaders, healthcare, payers. It's really a wide net, a big tent that working all together, we hope to achieve our goals. And a big way that we're doing this is by working with partners, and we've designated them as champions and supporters. So this is really falls within that campaign pillar that Georgia mentioned, really sort of building awareness, amplifying what Healthy NYC is and does and will do for New Yorkers. So the supporter level is really sort of a champion of in terms of communications. And then our next level is a champion, which is really supporter plus. So that's folks who are signing on to, yes, create some noise around Healthy NYC, but also they're doing something sort of up a level. They're either designing new programming or enhancing existing program that line up with one or more of our 7 drivers. They're using our employer guide. So many of our partners are employers and really want healthy workforce and healthy employees. So there are tips and tools in our employer guide that they can take in and utilize. And while our partners are committing to Healthy NYC, we also want to commit to our partners. So there are benefits to working as a partner. You'll receive toolkits. As Georgia mentioned, we have events that we invite our partners to, select resources, and we're really working this year hard on developing a full range of benefits that we can offer to our partners. I think our next slide really shows sort of the breadth of the folks there we're currently working with, and shows how we are celebrating them with some new badges that they can use to sort of celebrate their partnership and show off a little bit that, you know, they're committed and signed on to Healthy NYC.
Thanks, Denise. So talking a little bit about the programmatic side of Healthy NYC, because we obviously within the health department run a lot of different programs that support these goals. And I want to emphasize here that Healthy NYC is really a campaign. It's a North Star. It's really a set of goals that we can hold ourselves accountable to. And so the work of the health department was already supporting these goals. These are already issues that we care about, that we've had longstanding work around. And so it's not this totally new concept. It's really it's really just amplifying and uplifting the work that we're already doing and just applying a new framework to it. So we tasked our subject matter experts and our programmatic staff with coming up with a set of strategy maps, what we're calling them, which are kind of our roadmap for how we plan to achieve our goals. So I'll show you one on the next slide, but it essentially lays out a set of strategies, sub-strategies, and related activities that partners can take up, and also lays out the most relevant stakeholders for each of those activities. We are also engaging in a partnership with the Institute for Healthcare Improvement, which involves launching 3 learning collaboratives, which are really about quality improvement and investing in the programs and the interventions that we know work and just figuring out how to do them better and really uplifting that incredible work that the agency is already doing. So we're right now thinking about an improvement collaborative, learning collaborative. They're kind of used interchangeably, but one around overdose in the Bronx. And we're really letting the data dictate where we're seeing the biggest issues. And this will be like an infusion of you know, not necessarily financial resources, but really around how we can improve the programming that we're already doing. And then we are also thinking a lot about how to embed Healthy NYC in our performance management system. So ensuring that all of our divisions, where relevant, have goals that ladder up to Healthy NYC. So just to give you a quick preview, this is what one of the strategy maps looks like. These are available on the website, and we can certainly get this information to you through Pauline. But you'll see here that this is for the cardiovascular disease and diabetes goal. And so we've laid out these clear ways, and this is just a snapshot of it. It's much longer than this, but this is looking at, you know, the evidence-based interventions that we know work and what we think has the biggest return on investment in terms of health outcomes. And just to, you know, also emphasize, there is a lot going on in New York City. You probably hear often about all different kinds of plans and work groups and things that are going on. And all of them really are just supportive of the Healthy NYC goals. If you think about Plan YC and what, you know, all the different agencies are doing about climate change, or the blueprint to end gun violence, how that ladders up to our violence goal, or our women's health report, or the mental health report that we put out a couple of years ago. All of this is really in support of making New York City, you know, a healthy, happier place. And so I just want to emphasize that there's so much going on in the city, not just at the health department, that is supportive of Healthy NYC. And just to again emphasize, there's so much work going on that already is advancing these goals. So for example, there is an app called Teen Space, which is through the organization Talkspace, where teens 13 to 17 can get access to free therapy. We have a citywide doula initiative. We have the New York City Public Health Corps, which is getting community health workers out into the field. So this is just like an extremely small snapshot of all the work that we do that is directly correlated to the Healthy NYC goals. So I'm going to stop there. And if there are any questions, I will do my best to answer them, or we can get back to you. But really happy to present this to you, and also think creatively about, you know, what we could potentially do together, what some of the organizations or institutions are doing in this space. And even if, you know, some of them want to become partners, we'd be happy to have that conversation as well. So I will stop talking and turn it over to you guys.
Thank you very much. It's well done presentation, and the materials that you showed on screen were very nicely done, I think informative. And we probably would want to take a closer look at it. I know it's on the website, but if you send it to us as well. And again, I'd like to see if we could get it on our website and have a health section with our committee. We've been talking about doing that more recently. So that's going to be important. And thirdly, the forum, I'm hoping that we can have Healthy New York in a partnership way. You're partners anyway, of course, but in a partnership way at the forum, where perhaps there's some big diagram and demonstration, and you could talk directly to others in the community. I would like to see the outcome of the outreach that you've done, and see if there's a way you can measure that, present it to us. I know that's it's kind of hard. You're doing a lot of important work getting the information.
Yeah.
It would be interesting to see if there's been some impact, or what that impact is on the high school level. I know with Teen Space, you're basically in high school. But some of the other information that you've gathered. But otherwise, I think it's well done. Just have to see how we can help with that outreach.
Yeah. So from the health department perspective of all the programs we do, I know that, you know, our website's constantly being updated with data, and, you know, whether it be, you know, an EPI data brief or a press release, they will update when there's news to share about like users of a certain program. On the partnership front, we have actually had all of our partners, you know, lay out specific commitments that they're going to make. So once we hit like a year of that being completed, we will definitely be developing like an impact report, and would be happy to share it back with you. So definitely, you know, we're still pretty early on in the process. So once we actually can kind of harken back to some of the impact we made, we'd love to come back and share some of the lessons learned from the first couple of years.
Terrific. Monique, you had a question or other?
I did. So in terms of the law, I'm sorry, I missed the number. Local law 90, is it 93 or?
Yes.
Okay, and you're saying this is a law being passed by city council?
A law that was passed by city council in February of 2024.
And are you able to just give us a snippet of exactly what that law does?
Yeah, so it's actually pretty broad intentionally, so that it's really can be adapted to whatever is going on in the city at that particular time. So all it stipulates is that the city is required, specifically the New York City Department of Health and Mental Hygiene is required to create a population health agenda, and that will be something that we report out on every year to city council. So we just reported out for the first time in November of 2024. And I do want to note that the data, you'll notice there's a bit of a lag, and that's because COVID really impacted our ability to get out data as quickly as we used to. So we're kind of working to catch up, which is why we're releasing the 2023 data this month. And then we're hopefully going to be able to then catch up and release 2024 data in the fall. And that would mean that we're like 8-9 months behind when the year closes out. But there's so many different factors in our ability to get that data up and out the door. the other thing that it does is it says that the goals should be revisited every 5 years. So that would mean that we would be looking at a 2028 revisiting. So say there is like, God forbid, a concerning rise in some issue area, it would stipulate that then, we can set a new goal around that. But there's a lot of flexibility intentionally. So right now we're actually thinking about how to set some racial health equity goals prior to 2028. Obviously, there's a lot that can happen in 5 years. And we have the flexibility to do that in the way that the law was written. So happy to also share that with you. And I think, yeah, I'll stop there if there's any other questions.
So that's encouraging to hear, of course, given the current climate, especially around funding. I know DOHMH is local, so depends, I assume, on funding from city council mostly.
No, so city council did not provide funding for this.
Oh.
This is a set of goals, really like an accountability mechanism. So we are thinking about, internally how we can align resources to Healthy NYC, but it's not like a new program that then involves a bunch of resources. It's really about setting tangible, measurable goals.
Oh, okay. I don't want to hog up my question.
In the interest of time, since we have 3 other presentations, let me just see if you can give a quick answer to the status of the relationship with information gathering from the CDC in its current leadership, NIH. I know WHO, we are the United States pulled out of. But basically, I'm trying to, since you're gathering data from other places, how are you feeling about the trustworthiness of that data?
Yeah, and what's not.
Yeah, I mean, I think that I think it's hard to say exactly what the impact is going to be on our ability to collect the data that we need to actually develop our specific data for each year. So basically we get certain data from the federal government that then impacts what our life expectancy data and how that is disaggregated in New York City. And I would definitely leave that to our epidemiologist to further explain, because I'm not an epidemiologist, but I know that there are plenty of people within the agency who are keeping a very close eye on this. And I know for our purposes within Healthy NYC, we haven't seen any issues quite yet, but that doesn't mean that, they couldn't potentially happen at some point. But I don't necessarily feel fully equipped to answer that from an official agency perspective.
Thank you very much. Any other real quick questions? Thank you.
Oh, I see Danielle has her hand up.
Yes.
Yes, I've been having my hand up. So I just wanted to, I'll make it brief. I've been doing this a very long time. I'm a physician, I'm a medical director, FQHC, Chief of Medical Affairs. Years, okay, in FQHCs. What I can tell you about New York City is that the New York City Department of Health is very New York City Department of Health centric. You guys aren't perfect, you're great, but you're not perfect. I'll give you an example. When we had the monkeypox a few years ago, so so there was on the website, click here to find the local, place to have your monkeypox vaccine. Of course, it didn't work. I made so many phone calls. We will take, because Callan Ward was overrun, we will take as many people as you can send us, because we had 3 HIV providers, right? We could take care of this pretty easily. Nothing at all. Never was reached out. Nobody called me back, all of those things. And why am I telling you that particular story? For no good reason, but I will tell you that you need to engage the federally funded community health centers here in New York City, because there are hundreds of thousands of patients who are accessible to you, who need this, healthy NYC. So don't forget the Community Health Centers Association of New York State. And don't forget all of those people out there, because it's not just about the Gotham clinics. It's not just about the New York City Department of Health and about the data. Just get it out. And I see that, you're going to have sort of learning collaboratives. Do you think that any clinic has enough nursing staff and physician staff to actually put somebody, pull them off to go for an hour lecture? It's just not going to happen, because we're way too busy, or we do block the time and then there's a patient who walks in and that's the end of that. So I think whoever is thinking about this from the top is not thinking about sort of that bigger picture down at the boots on the ground. So with my very negative attitude, I wish you everybody the best of luck, because so Edwin Torres just put in some information, which it's so true. There's so many things that need to be done. And I noticed that you said a few things about increasing the number of people on Medicaid. Well, we don't know what that's going to look like. So hopefully, we just don't know. I don't think that New York State will be able to cover that $13.5 billion deficit that they're not going to receive from the feds, because New York State had expanded Medicaid and now they're going to have to let go probably around 1.5 million people now on Medicaid will be off Medicaid. This is in New York State. So we have many problems. And the CDC data, I wouldn't worry about the CDC data. It's just fine. Thank you. That's it.
Thank you, Dr. Milano. Real quick.
I mean, I guess when I was asking my question and I wasn't clear, and Dr. Milano hinted at it, the concern about, you said this initiative has been around and you guys are tweaking it to make it so that you can have better engagement and hopefully, of course, better health outcomes. The concern is the funding part, because we all know what's coming down the pipe. And the concern is, your ability to be able to move forward and carry out what you're intending to do. Certainly needs to be done, but will you be able to do it?
Yeah.
Same.
Yeah.
It's a great question. And I think we need partners like you and all of your institutions to also advocate, because there's certain limitations to what the health department, what the city can do. And so we need it's a moment where all of us need to come together and also advocate for what we know needs to happen in order to best serve New Yorkers. So it's a really important moment. And I certainly don't have answers to all those kind of big picture questions, but it's something we obviously think about every single day. We worry about all the time. But we also know that setting a goal is important. You can't actually get anywhere unless you set a goal and you try. And so we're going to keep trying.
Yeah, that's true.
And Edwin, I know Dr. Milano referenced you. I'm not sure if I'm missing a hand, please. Is that Monica with a hand up?
I think so.
Yeah, Monica had it before but I had a quick question for them too, but I'll let Monica go.
Okay, both of you. Monica? Oh, Monica, you're
You're
muted.
muted, Monica.
I really don't see where you're addressing mental health, because I'm a criminal defense attorney in the Bronx. I work for legal aid, and mental health is now at pandemic levels.
Yeah.
And we're not addressing it. Unfortunately, people are ending up in the system. The system is not equipped to deal with all the mentally ill people that are coming into it. It's taxing everyone: corrections, NYPD, youth services. I mean, it's just astronomical, but I do not see where that's being addressed. And second, what is the monetary value of what you're trying to do? How much will it cost? And given the cuts that we have coming, if they're not already here, they are coming. what is the dollar amount that you guys will need in order to do what you want to do?
Yeah, so both really good questions, and I certainly don't have the answers to all of it. So on the mental health front, we obviously as a health department, are the mental health entity for New York City, and there's so much work that we do that is not represented in Healthy NYC. I want to be clear that Healthy NYC is a set of goals around the top causes of loss of life. So we have 2 behavioral health goals within Healthy NYC, suicide and overdose. I understand that those are totally not encompassing of all of the many mental health issues that New Yorkers experience. So I do want to note that all of those other mental health issues are definitely covered elsewhere in the agency, just not necessarily through this particular goal setting process, because we really wanted to set goals that had specific percent mortality reductions. And so, I want to emphasize, I would encourage you to maybe through Pauline have like someone from the Division of Mental Hygiene who's better equipped to answer kind of the broader mental health questions, answer those questions for you. On the monetary value, so again, it's important here to note that, the health department manages a lot of money, and a lot of that already is kind of going to support the things that Healthy NYC represents. So I can't put a specific monetary value on it, but I just would note that when you look at the total budget of the health department, I would say a lot of it falls within those 7 issue areas, just because we know that those are, the things that lead to premature mortality or death. Like we are already focusing on those things because they are of public health concern to us. So I don't have a specific monetary value, but I think you can look at the budget and assume that a lot of it is being spent towards these issue areas. So I encourage you, if you have also follow-up questions, to go through Pauline to potentially get someone who might be, more equipped to answer your questions on those specific issue areas.
Edwin?
Hi, good presentation. I'm trying to understand sort of the difference between the aspirational goals that we have here in a community health assessment. I know in the community health assessment, it's a little more data driven. There seem to be some overlaps here.
Yeah.
That's number one. And number 2 is, what kind of collaboration do we see across agency? Because what I see with this program is to be more of a translator to the agencies, because not everyone knows how to read the community health assessment.
Right.
And with that being said, because look, if you take it locally here to CB9, all the metrics that you guys have as being top, there's one factor that exacerbates all of them, and that is environmental pollution. And the data is pretty clear in that. And we suffer here from a lack of intervention by the NYPD enforcing current laws that already exist. And these folks do not understand that this is not just an enforcement issue, but a health issue. That when these trucks are spewing nitric oxide and they're able to park in the street, right now, if you go to 157 before taking the highway, there's at least 4 or 5, semi-truck park over there. So, if this is just not getting out of, the Department of Health, and it's not going to the other agencies, this is just, a nice marketing presentation. But, the reality is that people are living in the communities are very different, as evidenced by what we see at CB9 and others in other communities, especially communities of color.
Yeah, thank you, Edwin. So on the community health assessment front, so as you and I'm sure many others know, all hospitals in New York State are required to submit community health assessments or community health needs assessments to the state and also to the feds in order to maintain their nonprofit status. And typically they also to the state submit a community service plan, which is, okay, how are we going to take these community health needs assessments and actually do something about it? And so These are typically aligned with the New York State prevention agenda, and we have been working with the hospitals here in New York City through the Greater New York Hospital Association to actually also help the hospitals align their goals with Healthy NYC. So that means a variety of things. It means helping them get the data that they need in order to inform their community health needs assessments and their community service plans. It means providing resources and language that they can use in their reports, ideas for programming that they can do, technical assistance. So we are working with the hospitals to try to align these things within the population health departments. On the collaboration, so I want to emphasize that there is so much work happening in the agency beyond what we're doing within this campaign. So obviously the health department, as you may know, I should say, have air quality monitors all over the city, and we have that data up on our website. And so I would really refer to probably my colleagues in environmental health to talk specifically about what we're doing with other agencies around air quality. But I know that Plan YC, for example, sets out a number of different goals that we are trying to achieve, and plans and all kinds of good things. So I would definitely not take Healthy NYC as the end all be all of everything we are doing. There is so much more happening in New York City between all of the agencies to try to address this, but it's something that we are deeply concerned about, and certainly are thinking about a lot as an agency, and something that we've specifically highlighted within Healthy NYC, because we know that it is an exacerbator of all of the issues that we've laid out. So again, happy to probably also defer to colleagues in our environmental health.
Yeah, thank you, Georgia. I think it's very important to look at this from the lens of equity. You would never see a truck park in Park Avenue or Lexington in 77. That would just never fly. Now, when you come to certain communities like CB9, that will be very nonchalant about it when it comes to enforcement. I think that you have the data here that show that this impacts health, and these other agencies that are sisters or brothers to the Department of Health should be taking action, because people's health are at risk, and we see that in the numbers, and these are real people.
Yeah, totally agree.
Thank you very, very much. And I'll just follow up with Pauline. Thank you so much for bringing these experts to speak with us, and for an excellent presentation. And I appreciate all of the comments that follow those. And if you could, Pauline, maybe get back to us maybe with some of the answers, and if there's someone who could talk to us about air quality or pollution in that Department of Health, Mental Health, as well as I remember sending to you also a request to get some follow-up on the mental health program that the mayor touted back in, I believe it was February, some $950 million program or something like that, dealing with mental health. So if you can, or lead us to where we can get a follow-up on that, as well as the introduction of a sub-panel and some discussion on what's happening, what's the latest in tackling air quality pollution.
Will do, Laquita. Thank you.
Thank you again.
To that
Okay, yes.
direct deaths bloody deaths by traffic violence in New York City are about 250, 260 people per year. And air quality deaths are on order 10 times the number of pedestrian deaths. So like 1,500 to 2,000. So I found when you said violence and you said homicide, but you didn't include traffic violence, the big miss, and not including the air quality piece of it is also a big miss. And so I'm glad that Dr. Torres added that in.
Yeah. And you just heard from Dr. Allegra LeBron, who's going to, as part of the NASA presentation. So in anticipation of all of that, Thank you so much again. It was excellent discussion.
Yeah.
And we'll
Thank
move
you so
forward.
much. I think Denise and I are going to log off, but best of luck for the rest of the meeting. Thank you very much.
Thank you. And now
Thank you.
Dana Hale with the William Randolph Hearst Burn Center will provide us with the Burn Center's medical and community resources.
Laquita,
Monica?
I have a question for Pauline.
Oh, is she? Oh, yeah, she should still be there.
Hi,
Uh-huh.
Monica.
Hi, how are you?
Good, thanks.
In light of the article that was not so favorable to be heard, can you guys prepare a presentation for the community board or the health committee about what's going on and what improvements you're trying to make? Because that article is terrible.
Yeah, we don't have a large part of Be Heard, but I will reach out to H&H, who is the lead agency on Be Heard, to
Great,
see if
thank
they
you.
can come to the board. I'm happy to organize that for you.
Thank you.
Sure.
And if we get information soon enough, Pauline, our next general board meeting will not, this one I suppose will be too swamped, but in September, we could make that a possible goal to have key presentation on that.
Sure, we'll do. I'll work on that and I'll keep you updated in my progress.
Okay. Okay, thank you.
You're
And now Dana. Thanks, Monica.
Okay, hi everyone. My name is Dana Hale. I'm the Burn Outreach Coordinator at the William Randolph Hearst Burn Center. That is the burn center at New York Presbyterian Weill Cornell. One of the NYPs, not Columbia, near here. Weill Cornell is on East 68th and York Avenue. So our burn center is actually the city's largest burn center by bed count. And we are the only burn center that is verified by both the American Burn Association as well as the American College of Surgeons. The American Burn Association, the ABA, is the only real national accrediting body for burn surgery and burn centers. So some other hospitals in the city have burn beds and burn centers, including Harlem Hospital, which would be your closest hospital probably for CB9. Though Harlem Hospital only has 3 burn beds, we have 20 plus beds at the NYP Burn Center. And we are also the only burn center who has a lot of this ancillary type activities going on. Most of which I want to point out is the burn prevention and professional education outreach. And that is primarily me, but really it's a testament to the needs of the city that we have this department. And so, burn deaths and burn injuries are not necessarily of the highest need in terms of death and injuries, but most burns are preventable. And so these injuries and deaths are preventable, and we work with citywide agencies. Our goal is always to make sure the city is as safe as possible. So at our specific burn center, we treat about 400 patients inpatient, but over 5,000 outpatient, all ages. A lot of times when someone says burn, they're just thinking of a house fire or some sort of flame. Actually, over 50% of our burn injuries in New York City are attributed to scald injuries, which is any hot liquid. A lot of that we see, unfortunately, is hot tap water with children, as well as, hot liquids in cooking as well. We also treat inhalation injuries, so that would be from smoke inhalation, other sorts of large-scale dermatological diagnoses, and other chronic wounds. I want to draw your attention to kind of the socioeconomic risk factors for having a burn injury, as well as sustaining kind of complications and recovery from a burn injury. So age, infants and the elderly are most at risk for sustaining a burn injury. The male sex, men in every single age range and in every single burn mechanism are at a higher risk. Sorry, buddy, but are at a higher risk for sustaining a burn injury.
having a mental health disorder or a physical disability, substance and alcohol use, low socioeconomic level, and low maternal education level. So really at the crux, just a lack of access to safety mechanisms and safe living and working conditions is something that we take into account. So there is, within our burn center, we do a lot of work, starting with prevention all the way through the acute phase of a burn injury, and then into the rehabilitation phase and making sure that these patients are able to re-enter into the community and into their lives as able as possible. I just, again, want to draw your attention to prevention and pre-hospital, because that's kind of why I'm here. So part of our outreach department is really using data and trends to identify those communities and those populations that are most at risk of sustaining a burn injury. We partner with different agencies, small all the way through federal, not very much federal, to try to prevent these injuries. And then my job is to tailor kind of the outreach in order to make sure we're hitting the right goals. Another part of my job, though, is ensuring that pre-hospital care is high. So when you get a burn injury, especially a large burn injury, most of that care, that initial, first 12-hour care is really, really, really important. And that often does not occur at a burn center. It occurs it starts occurring in the field, and then you will be transferred to most likely the hospital that you are nearest to. And so part of my job is making sure that urgent cares and other regional hospitals are equipped with the knowledge they have to really care for you in that need. What I wanted to talk to you guys here tonight, and I live in CB9, but I'm also hitting some of the other at-risk communities, community boards. So we have been tailoring our prevention messaging more towards these individual kind of level behaviors. And so that is great. I hit a lot of senior centers and youth groups, and we talk a lot about cooking safety and again, very individual behaviors to stay safe, and that's very important. But there are larger spheres of influence that I think could do a better job of keeping New York City safe on a whole. And so I'm interested in better understanding the needs of, Washington Heights and Hamilton Heights and Harlem in general. We are already partnering with a ton of neighborhood partnerships, including, our most important one is probably the FDNY Paramedic Corps and other EMS services in the city, and making sure again that when these incidents do happen, you guys are receiving the best care. But in terms of actual, CB9 considerations, so fairly large population, actually, so in terms of, children and the elderly, which are the most at risk, you guys have lower rates of those two population groups compared to New York City averages. This is as per the 2020 census. But you do have a lot more rental properties than New York City average, and a lot of students. You've got a lot of schools and colleges in this area, and a lot more, buildings over 12 floors. To me, that tells me risk for scald injuries. You've got tenants that do not control their hot water heater. I know I live on 139th Street, and my hot water heater is often set to like 190 degrees. And also the risk for obviously a house fire and smoke inhalation is greater when you have these larger buildings. I also wanted to touch on lithium ion battery fires, because that has been also a hot topic. So in 2024, actually across the board, New York City saw a decline in injuries due to the lithium ion batteries. there were a decline in the actual fires, but also more of these fires were happening outside of residential areas. Now in 2025, the first quarter of 2025, we are seeing another uptick. I'm not seeing in our facility an uptick in injuries. I don't know, the FDNY has not given out really data on that front. But they are ramping up their public education campaign again because they are seeing an uptick in these fires. Are there any considerations that CB9 has in terms of house fires, scald injuries, any other kind of niche burn injuries that anyone can think of? Then I guess the other flip of the coin is I am always looking for different community partnerships. I already have great partners with the some of the MJHS Senior Center in Norks, the naturally occurring retirement communities. Thank you. And so I've already developed those partnerships pretty well.
I'm thinking about our libraries, because I noticed you have Brooklyn Library in Queens, so we have a very active, a couple of very important libraries on 125th. They come to our meetings to report also. On 125th Street, oh my goodness.
And the other one is
And 145th, and all of a sudden I'm going,
Yeah,
oh,
so-
Hamilton Grade.
Yeah, so 45th is my library. I've been trying to get put in touch with the New York Public Library's like health outreach department, because that's who I
We
partner
may be able to
with.
help you.
Yeah,
with
I think that would be helpful. That's why I partner with the Queens Library and the Brooklyn Library.
And I think probably the Boys and Girls Center should be good, because that's where a lot of health, safety, fire,
Okay.
even fire drills and all that kind of thing begins. But I was also thinking there are tenants association, two in particular, I think with Broadway Housing, for
Okay.
example, they're really nicely run, and Fortune Society has more housing also. Those may be additional partners, and we could possibly help you with
Yeah.
that there.
Okay.
Do you know, you did mention something I was interested in, that's the lithium batteries. And I was wondering, we need to reach out to FDNY to see what flyers and promotions they have.
Yeah.
In
I think-
addition to the television that, promotion they might do.
Okay. It might be what's on.
Okay. Restaurants might be good partners, or at least outreach for those flyers, because many of their drivers should get the flyer, they go home and maybe their learning is getting better, they're not, they may be taking their batteries out of their bikes before, going into the apartment buildings. There may be certain things that they're doing, but they still would be a
Yeah.
market.
That's a good point.
A lot of their bikes delivering
Yes.
food.
Do you have some?
I live in, we live in Newark, right over here, Morningside, known as Morningside Gardens.
Yeah.
And I was curious, if you have data on our particular area. In other words, you mentioned an uptick, or there's not really.
No, so the last time our burn center data was pulled was in 2023, and I think it was looking at like 2019 to 2021. And those COVID years were kind of confounding years, because for essentially a year and a half, we didn't take care of burn patients. And that data, unfortunately, I have looked at it. I didn't quite like the way it was assessed. So I've pulled data. I'm hoping to pull data this year to take a better look at zip code, because that's not how they formulated their data search last time.
I agree. Tenants associations are like ours as a co-op community, and we do a pretty good job of communicating things. But even if you had data that you personally believe is representative of the types of burns that are typical in our community, I think that could be very compelling for education purposes.
That, yeah, I mean, that's why I've only been in this role since January,
Yeah.
and so
Yeah.
that's been on my list of things to do. Unfortunately, we've had some restructuring within the hospitals.
So this is great, thank you.
Yeah. No,
Um,
there's, you should look to make sure there's nobody online.
I was just about to ask if you could, in the,
yes.
it's like to see whose hands might be.
No, that's
up.
very, you know, you talked about
Any
scolding.
hands up
Yeah.
on,
Thank you.
do you see any hands up there? Oh, and we lost Ashley, I think we need
Somebody
your
jump
help.
Oh,
The other screen.
excuse me. Hi.
Any hands up? Do you see any hands, Dana?
I don't see any hands, but I also
Okay.
don't know how to fix this.
Ashley stepped out too, so hopefully,
So hopefully she'll be back in a
This
minute.
is still up and running.
okay. And
So
Dr. LeGrand?
So the Family Welcome Center for New York City's, for Manhattan Schools is right over there on Morningside. It's 123 Morningside Drive.
Okay,
So that be a good.
yeah,
spot.
that would, I've
Cover
actually
area.
been,
And the second thing I was gonna say is that, there is, for the folks concerned about the lithium ion battery fire, there's this brand new program by Department of Transportation for sidewalk charging cabinets. And, if you see hot spots for deliveries just having fires, like that would be someplace that you'd wanna put a cabinet.
yeah.
Yeah,
Mhm.
yeah, that makes sense.
Thank you. If there's someone we may have missed online, I'm not, sure, can you just speak up?
I'll speak on it. With our aging infrastructure, I've noticed there's been an increase in like electrical fires.
Yeah, so I only have like the FD, I only have, access to the FDNY and they,
Recording, let's see. It should be, I think.
it says recording.
Yes, it's still recording.
Okay,
Yeah, I just unplugged my USB, I think that was this.
okay.
And it is a decent amount, I think it's like 70 something percent of residential fires are usually, attributed to an electrical cause.
Chemical burns.
Chemical burns are actually one of our least common mechanisms in the city, but the chemical burns are very devastating, and so the impact is higher. And also, I have actually been targeting some of the hospitals in the area on chemical burn care because we don't see it very often. That means it's kind of one of those, low frequency, high risk type of situations.
And what about radiator burns?
Radiator burns, yeah.
Falling on radiators, that's another commonality, especially the small children.
Yeah, radiator burns are ubiquitous, during the winter. And there was, to my knowledge, a couple of years ago, there was a push to try to make radiator covers. But I don't think that really went anywhere. Same thing with a maximum water temperature. New York City only really has a minimum hot water temperature regulation. There's no real maximum water temperature regulation. And so those are things that I think have been addressed in past years and hadn't really gone anywhere. I would love to maybe try to address them again, but I do think first that needs some data, which is gonna take me some time to get.
I mean, the scolding thing is very real. I mean, when you're trying to bathe your child and not being aware.
Yeah.
And the water might come out so hot. I mean, I've burnt myself trying to wash my hands, so some way, somehow that probably needs to be, something as simple as that could be so impactful.
Right.
Resurrect it and remind, people reminded. Even if we put that on our web page as the winter comes, Laquita, be careful
Yeah,
of
I
how
mean, maybe-
water burns.
Yeah, I can make a little like infographic for you guys to.
That would be wonderful.
Yeah.
Fixture where it can't go above a certain temperature.
Really?
Yes, with new.
Well, yeah.
fixtures. But see, we have aged
It-
infrastructure.
Yeah, and that also, I don't know if that's a regulation. I think that just requires that the homeowner to opt into that.
Right.
And it's part of the mechanism of the fixtures, that it can't. go
Oh,
above a
okay.
certain temperature. But again, we have old buildings.
Yes.
They don't have a lot of the new technologies.
Right.
in
It's a good-
building.
Good observation, good point. Thank you.
Yeah, 'cause I bought the heads by
My
cartridges.
cover these
that
maximum
can only go
temperatures for the
so
boilers, like, because residential emissions are actually New York City's principal CO2 emissions.
I'm going to ask
Yes.
David, who's
Yes.
gonna be coming on from We Act,
So
if he knows that,
environmental,
because he's
yeah,
been heavily
okay.
involved.
Mhm.
David, keep that in mind, that question, in terms of New York City, if there's any particular law regulating, how did you word it, Dr. Lorraine?
That I'm surprised that it's not covered by residential
Climate
greenhouse gas emissions, like the residential emissions from buildings are one of New York City's principal greenhouse gas components. Like most cities, it's transportation sector, but in New York
Yeah.
City, it's buildings. And you think that like the maximum temperature of the boiler would feed into that.
It makes
David
sense.
just,
Yeah.
It's
Yeah, I
And-
got that, exactly, yeah.
Okay, because he's gonna be speaking a teeny bit. Let's see, are there any other hands? I'm gonna ask, we have 3 presentations left. We're doing pretty good, but because we have such great topics and presenters, we've gone a little bit over each time frame. But if we could tighten it up a bit, we'll move forward. And thank you so much, Dana. It was wonderful.
Yeah, no, thank you.
Rose
for your-
discussion. We're gonna have the update on City Harvest's grant with the West Harlem Development Corporation. Rebecca, if you can, will you need
I think I can just share my screen here. I have a short presentation.
you can keep
Can you
it,
see that there?
Yes, as short as possible. It's coming up. There it is.
Yes, I will be very short.
Less than 8 minutes.
Yes. Yes, my name is Rebecca Silver, and I work at City Harvest. We received a grant from West Harlem Development Corporation, and I presented back in October. But as we're approaching the end of the grant period, I just wanted to come and give you all an update on some of the work that we have been doing in the district. So just quick background, City Harvest is New York City's first and largest food rescue organization. And we specifically focus on fresh produce. Over 70% of the food that we deliver throughout New York City is fresh produce. And this year we will rescue and deliver, we're up to 83 million now, nearly 83 million pounds of food across all 5 boroughs in New York City. And our fiscal year ends at the end of this month, at the end of June. Just some basic statistics that we use to look at of food insecurity. Based on the latest data that Feeding America puts out, which is kind of the consortium of food banks, almost 1 in 4 residents of MCB9 are considered food insecure, and this is up significantly since pre-pandemic. In addition, in households with children, and children specifically, 1 in 3 children, and this is in Congressional District 13, don't know where their next meal is coming from, and this is compared with 1 in 4 citywide. And then in addition, we're seeing food pantry visits continue to increase. Even as we, kind of come to the 5-year mark on the pandemic, we're still seeing increase in visits to our food pantry partners. So we currently have 4 food pantry partners that we deliver to on a regular basis in the district. And then City Harvest also has our own distribution that's located just on the other side of the street of the district, but we know that we do serve a large number of residents of MCD9 there. And through all of these, there's a pantry open at least Monday through Friday, and then some weekend days as well. And then just looking at the support that we're providing to Manhattan Community District 9 and the number of pounds, we are increasing our pounds every year. And so you can see compared to pre-pandemic numbers, we've more than doubled our pounds that we're delivering there. So this year we're at just over 500,000 pounds of food. And I think the goal by the end of the month will be to have 575,000 pounds delivered. And like I said, most of this is fresh produce that is otherwise hard for our community partners to get. And then we also know that our food pantry partners need more than just food if they want to sustain kind of the level of impact that they're having in the community. So we do have a team that works to provide different types of equipment investments, as well as some monetary investments. So 2 of our partners this year received some of those investments. So you can see we did a repair of a fridge. We also bought a new double-door refrigerator for them, as well as a conveyor belt, just to help with distributions. This allows them to store food for longer. And then also we provided Broadway Community Inc. With a personnel grant, so they could provide a stipend to their soup kitchen staff. So this is something, you know, that our team is working around the clock on, to see kind of what pantries need and doing those assessments to try and get them that food. And then just our Prince Hall Mobile Market, which I mentioned before, is located just outside the district. This is City Harvest's own distribution, and this is mostly fresh produce. And so this year we're serving just under 300,000 pounds of food, and around almost 11,000 households have visited so far this year. And we're still seeing that increase, and committing to more pounds being distributed through this market next year. And I know we are short on time, so I can send the video out after, but it was in a short interview with Broadway Community Inc. But that's just a short update there. If there are any questions, happy to answer, if there's time.
Are you anticipating, Rebecca, a higher cost in your being able to provide, you know, the food and all that you do based on anticipated tariffs, which we don't know, well, I'm sure it's going to hit, but we don't know how that's going to hit.
Yeah.
Are you able to anticipate?
We are, you know, we're trying to anticipate as much as we can. We are a food rescue organization. So we don't pay for a lot of the food that we get. It's donated food. We do pay for it to come to us and for us to get it out into the community. And that cost has doubled since before the pandemic for us. But it's still at 44 cents per pound of food. So we're tracking that. You know, we've also made some commitments to increasing our food purchasing of culturally relevant and religiously required foods. And so that, you know, is something that we're especially tracking there, the prices. But so far we've been able to reach all our goals that we've set.
Okay, very nice.
Could I throw out a question? Because this is very much connected to the kind of work I'm doing with Food and Water Watch, in some respects. By the way, Jilly Stevens of City Harvest, we hope will come to the Society for Ethical Culture and talk to us. I'm a board member at the Society and hope you'll all tune in when that happens. I'll keep it posted. Food waste is horrendous. I mean, catered events of all kinds, including a lot that I find myself at, it's a tragedy and it's a crime, I think. So I'm so glad that City Harvest is able somehow to rescue some of this. And would like to know how to become a partner of yours, and perhaps get my university, Fordham, where I work as a librarian, on board, because its catered events, like just about all catered events, wind up with a lot of leftover food that really isn't fated for anything better, and not even composting. I mean, we really at least have to get a composting plan in place if we cannot rescue the food. That was more a sermon than a question, but thanks for listening.
Yeah, no, food waste is definitely, huge issue. And we're happy, you know, that we're able to, you know, rescue some of it. I will say for those more local events, what we do like to do when we can is coordinate with our local pantries to do a pickup themselves. And so I'll drop my email in the chat. And if you know, want to reach out to me, I'm happy to, you know, put you in contact, you know, with our network capacity team there, who might be able to see if there's any connections that can be provided.
Okay, thanks, Rebecca. Great.
Yeah.
Now, I can't see our screen, but if there's anyone who has their hand up, just kind of speak at this time until we get it.
I don't see anything.
Okay. Thank you, Rebecca, and I'll look forward to having the video so that we can present it as well to the larger audience. And thank you for your understanding of that. And for the excellence with the City Harvest program and how you're using the grant. Thank you so much. So we have two more presentations. It's not often that we hear from someone who's living in the community, who has been active working with some of our partners, who is available to speak and say what it means in their community to have certain programs. So in a short period of time, let's say 10 minutes, and we can always ask you some questions afterwards, David.
Okay.
If you could talk about, you're an environmental enthusiast and a We Act member.
Yeah.
There's the current New York City Council intro to 1180 that you
Mhm.
wanted to talk about, which will cap renewable energy credits
Mhm.
to 10%, and then the New York Heat Act.
Mhm.
So if you give
Right.
us a quick overview and kind of tailor it to no more than if you could do 8 minutes, and we'll have Q&A after that.
Okay,
And
I'm looking at the time here says 8:04. I will try to stop at 8:12. I'll try. And so, okay, yeah, the intro 1180 is really tied to local law 97, which some or all of you may know of. It's dubbed New York City's climate law. And it's well named because really it's a very ambitious piece of legislation which mandates that buildings over time in increments up to 2050, the largest buildings in particular in the city, over 25,000 square feet, attain incrementally higher levels of building energy efficiency. And many of the buildings affected by this law are well on their way. They're doing well. That's a really good testament to the viability of this bill. And it will, as somebody pointed out earlier, reduce considerably the greenhouse emissions of this city as a whole. The building sector accounting for 65 to 70% of all greenhouse emissions from the city, even over the transportation section, which is pretty amazing if you think about all of our trucks and buses. So the problem is that Mayor Adams, about a year or so ago, really kind of caved to seemingly the real estate industry, landlords who wanted a way out. It didn't want to have to make the upgrades to their buildings, which would bring them to energy efficiency standards as mandated by local law 97. And so this sort of detour or this way out called renewable energy credits, which are not bad in and of themselves. Mayor Adams allowed to sort of act as a surrogate, as a substitute for actually making the needed building improvements. And that is absolutely inadequate because the buildings themselves will continue to be the cause of huge greenhouse emissions, because most buildings ultimately are powered by fracked gas, right, or oil. And we in Food and Water Watch are especially concerned with getting New York State totally free of fracked gas, all operations, power plants, extraction facilities, processing facilities, transport hubs, because at every level of action, including the laying in of new pipes, and we've all seen that in the past years, our streets literally being ripped open for new gas infrastructure. All of that is highly destructive. It's disruptive. It poisons the air. Even, and me with my standard bicycle pumping uphill to get to work, I'm really hurting with all that bad air. So we really want to move the city toward 100%, by 2050, 100% building energy efficiency. That sounds like a huge ideal, but we can get there. But Intro 1180 is designed to severely limit the amount to which landlords, building owners can offset their excess building electricity emissions via the purchase of renewable energy credits. They really are going to be compelled to make those building improvements. In many cases, they have neglected their buildings many years. So yes, they've got a pretty expensive job looking ahead. And It's possible that the New York City Accelerator Program, maybe NYSERDA will kick in some funding or some help, but it's really got to happen. I mean, climate stability is absolutely necessary for our kids to have a future, a hopeful future. And I've got a 25-year-old who just graduated Columbia with a master's in architecture. So
Congratulations, David.
yeah, thank you very much. Yeah, he's wanting to do green architecture and affordable housing. That's two things he's interested in, which is fabulous. Yeah, he's a hardworking young man. So that's local law. That's LL. I'm sorry. I'm getting ahead of me. Yeah, Intro 1180. That is a city bill. We need Sean Abreu to sign on with us. So if any of you have the heart to give Councilman Abreu's number a call, ask him to sign on as a sponsor of Intro 1180. I'm going to do that this week. Again, I'm being kind of a pest.
Has he stated why, or anyone who's against it or hasn't signed, have they stated why?
Well, you know, I don't want to cast aspersions on any politician's motives at all, but again, the real estate industry is a powerful, powerful industry in New York. They are very influential. So it's understandable that a council person's gonna listen, you know, when a real estate mogul speaks up and says, look, you know, I'm willing to pay renewable energy credits, but we've really got to catch a break on from the mandates of Local Law 97. It's just too much. But the fact is, we need it. We really need a strong local law 97, and that's what Intro 1180 will assure. So please take a look at it. I linked my reference to Intro 1180, La Cuita, when I sent it to, you know, as one of my talking topics. And the same with this next one, which is a state bill, a New York state bill, and that is the New York Heat Act. The New York Heat Act, you know, as I mentioned in my synopsis to you, will cap energy bills at 6% of household income. As it is, I don't know how many of you have noticed, but energy bills are skyrocketing. They are becoming a huge part, an excessive part of many disadvantaged families' household income, and they're having to forego essentials just to pay their utility bills. It's almost like extortion on the part of the utility companies. So this will, and this is the biggest environmental justice piece of this bill, which I love, it will cap the bills at 6%. That's as much as they'll have to pay of their household income. It will also end the 100-foot rule, which has been this ongoing subsidy that wastes $200 million a year, because it's basically subsidizing the gas companies, the fossil fuel companies, continuing build out of gas infrastructure, which we absolutely don't need. We must avoid that. We've got to go renewables. This bill will also empower clean energy upgrades and reduce dependence on volatile fossil fuel prices. Frac gas is a multi-sided. It's kind of like a hydra of bad energy. It's at the extraction point, many communities nearby have their air and water poisoned. You may have heard of Cancer Alley in Louisiana, Texas, Oklahoma. Many of those families suffer greatly just so we can get heated homes in the winter. And I just can't stomach that anymore. Also, pipelines are very, very, they're treacherous. I mean, a tiny crack can emit totally invisible methane into the atmosphere. Methane is a hugely potent climate destructive gas, far more potent than carbon dioxide. It's just another reason we've got to get off frac gas. So both of these bills are very important. Our Assemblyman, Michael Lasher, does support very enthusiastically, to use that term again, the New York Heat Act. Bless him. You could call him if you want to thank him, but we need also Speaker Hasty on board with this, and Governor Hochul herself. So feel free to call, leave their offices messages saying, we need this, our kids need this, for you to stand up for their climate future. that, that's basically those two. I mean, there are all kinds of environmental issues we're facing. Plastic waste is horrible. Microplastics, horrible. But we'll just keep the depressing news down right now. I'll just, if you've got any questions, and if there is time right now, or I can answer later, perhaps, be glad to.
It would be good now if there are any statements or questions. I want to add that City Council, New York State Assemblyman Jordan Wright has signed on, supports the New York Heat Act. He's one of our assembly persons.
Okay.
Elected.
Great.
What about Taylor? Has he expressed, is he, I assume, aware of this New York State Act?
I thought he had, but that's a good question. David.
I'm not sure about Al Taylor. I think the assembly is pretty much on board with it. I think it's mostly, at this point, Speaker Hasty, who needs to let it come to the floor. The speaker has that power to let the bill come to the floor for.
He's got a lot of real estate lobbyists, I think.
He does. Yeah. And Governor Hochul is sort of okay with it, but she's just too lackadaisical. I mean, this is all an essential part of the Climate Leadership and Community Protection Act, which you may recall Governor Cuomo finally signed back in 2017. And we need to enact that law to its fullest extent, and that's what LL 97, the New York Heat Act will help do. So yeah, it's coming to a head. The budget season is going to be up soon, and we'll find out. But fingers crossed.
Yeah, David, it's so great to have someone who is so well spoken from the community as an activist, able to come and speak. And I appreciate your reaching out.
Sure, glad
several years ago, David also organized a group, Siren Serenity.
Yeah, Serenity. SIRENITY. Serenity. Get it?
Of the ambulance alerts that were going off every few minutes because people had to be rushed to the ambulance, but it was the sound, the pace, the decibel level, and all of that.
Right.
We need to have your latest on that. I know you developed a book or put together a brochure. The siren.
Well, we have, if I may just inject one more detail here, Brian Coyle, who is a sound engineer from California, came all the way out to New York with his device. It's called Siren Guide, and we got it tested on a Mount Sinai ambulance or two. It didn't work because the device, it turns out, did not accommodate the design of the siren itself, and he now knows that. He's going to adjust it, and we're waiting very hopefully for the second test, and I will let you know how that goes.
And doesn't it have to go through a federal body in DC to approve?
Yeah, it's kind of mysterious because FDNY is the authorizing agency in terms of siren use policy. But I mean, lately Mount Sinai has displayed some flexibility because I have not, for one, heard many at all sirens going off at 2, 3, 4 in the morning, and that's what was literally killing me years ago. So it has improved, but no, Mount Sinai themselves don't call the shots in terms of their own siren usage.
I applaud you and your group's effort because that was a major task and you guys took it on, and there is a difference. And then how many years has it been? But it's made a difference.
You good? Well, that's good to hear. That's good to hear. Yeah. I'll let you know. Yeah.
Any questions or concerns? That was excellent, David.
Well,
a lot of work is not done yet. So I wish you guys a lot of success.
Okay, well,
I sit
appreciate
on
that.
one of the working groups. Any other question or other? Okay, thank you again. And now we come to a group that I got to know through Dr. Allegra Legrand, because she came to the community board, general board meeting on this past Thursday, without this, well, the last general board meeting, and just got up and spoke at public session. And so people heard, I think it was very, the audience, our members were very receptive to how you presented and what you presented. So I think how we can do this segment, Dr. Allegra Legrand right here, Dr. Ann Friedling there, and Dr. Andrew Ackerman. And I, full disclosure, they're husband and wife. So anyway, and come with their own expertise in the environmental area. So I think, and I asked her, I said, well, based on what you reported, can you provide a resolution, which she whipped up. I didn't know we had NASA in this district.
Exactly.
NASA.
When you spoke, I was aghast because there are so many young people, believe it or not, in CB9 who wear paraphernalia that says NASA on it.
Yeah.
And I think it's so cool because I thought I was nerdy when I was young, but there are a lot of young people who think NASA is cool. So when you came, I was so upset that I wasn't aware of it, let alone other members of the community. So
we have
what a jewel.
We have community partners that are doing great things, and many of them, as you hear tonight, are come to our meetings, and they've presented. Or sometimes have to get on for a short time and then jump off because of another meeting that they have to attend. And so, as a matter of fact, everybody look in the chat. Dr. Christine Maritzi of BioBus left a message announcing something, and I'm hoping Ashley can help us pull that off of the chat. Some big programs she works with, a flyer, yeah, and the information. So anyway, we have a lot of wonderful people who come to present to us, and we try to help. And one of the ways that we can help our community and our community partners is through resolutions. And our resolutions do have, I think, impact. As long as we have city council people, the mayor, or the assembly persons, willing to address it and present to the larger bodies that they sit on. So I know it's late, but we didn't know until you presented to us. And if you know any other group like this, because this is the era we're in, the problems stemming from federal government, which are made up. They don't have, this didn't have to happen. So anyway, NASA, the three professionals holding up and being supportive of their agency and the body that's represented here in New York. Tell us about it and weave the resolution into it.
Oh, sure. So thank you first very much, Laquita, for having me. My name is Dr. Allegra Legrand. Just want to say I'm here tonight in a personal capacity, but I have been a member of this community since 2001. And I lived in this community for a while, and then I couldn't afford this community. So now I live up in Community Board 12, which is also a wonderful community. And I'm biking to work Board 9 and 12 for the last 24 years, and it's been really wonderful. So let me tell you a little bit about the first. Shall you guys want to introduce yourselves, or should I just start?
Go ahead, and we'll let it evolve. Thank you, Allegra.
I'm so glad my colleagues came out and joined me tonight. So NASA was formed, in the 1950s, and when NASA was formed, most of the NASA centers were being built in the suburbs of cities. So everyone's heard of Houston, we have a problem. Well, actually, Johnson Space Center is way, way on the outskirts of town. The same is true for Kennedy's in Florida or Marshall in Alabama. Goddard Space Flight Center, which is our umbrella organization, which is halfway between Baltimore and DC, really not in the middle of town. So the founder of our institute is this guy by the name of Robert Jastrow. He was afraid that NASA and federal scientists would have, these are his words, intellectual incest, in that they would have an echo chamber where they spoke only to themselves. And so he wanted to put a NASA facility embedded in an academic community to make sure that there was a free exchange of people and ideas, and that the government scientists would, and the government in general would be at the forefront of research. And so our center was founded in 1961. It was originally in the Interchurch building, which is over on Claremont and 119th Street. And then in 1966, it moved to Armstrong Hall, better known as the diner from Seinfeld fame. It is also the home of John Dewey of Decimal fame, and Suzanne Vega. She came in and serenaded us on our final day. She said that she was not even aware, as she was writing her song, that upstairs Jim Hansen was getting ready and prepping his testimony before Congress in the 1980s. So we do all kinds of research there. We do, in the beginning, it was more space studies. And so like terms like black hole were coined in our building. Pulsars and quasars, those terms are also coined in our building. John Mather, who discovered the background microwave radiation of the universe, he was a postdoc in our building. But in the 1970s, there emerged a consensus that instead of just studying planetary atmospheres, which are one of the leading scientists at the time, this guy named Jim Hansen, he actually figured out that Venus's atmosphere is made of sulfur dioxide, and he got his fame for that initially. They said, you know, carbon dioxide is starting to be a problem on this planet Earth, and we know what that means for other planets. So they started looking inside, and so some of the seminal work that determined how much global warming would happen with increasing greenhouse gases happened at two labs. One, ours here, Goddard Institute of Space Studies, and the other, Geophysical Fluid Dynamics Laboratory, which is in Princeton, New Jersey. It's a NOAA laboratory. And the groundwork for how much warming we can expect with increases in CO2 was laid out by 1979. As I mentioned, Jim testified in front of Congress in 1988, having continued to develop that model, and we still are working on doing climate simulations today. We don't just do simulations of Earth's climate, we do simulations of all kinds of climates for rocky planets. So if you look out in the stars and you wonder if a planetary system, if that planet is habitable, the folks doing the simulation of that planet to instruct the folks interpreting the telescope retrievals, that's happening in our laboratory. And we were going fine and well until the end of April, when DOGE evicted us from the building. We have actually, like, NASA and Columbia had, through GSA, which is the real estate agent branch of the government, they had an agreement to their lease doesn't end until 2031. So as far as I know, the government will continue to pay $3 million a year for our lease and the renovation, which we recently finished. And I don't think it's saving any money.
They pretty much have said as much on various commentators.
I wanted to say, like, listening to this meeting here, things like how will air pollution impact New York City? Well, folks, there are folks in our building who are absolutely on top of that. Like Julian Watkins, who's the Assistant Commissioner of the Department of Health and Mental Hygiene. He was just at GIST last year with his team. We have a large climate impacts group who works very closely with New York City. New York City was one of the first cities to have its own tailored report, the New York City Panel on Climate Change, to say like all the facets of climate change and how specifically it would impact New York City. That was designed in our building by our scientists, World Food Prize winners in our building. And then Yes.
So,
Larry,
I wonder if you could comment briefly on the education program.
Oh, sure.
And the outreach we do, which really covers K through 12. We have an incredible outreach coordinator, and Allegra's been really involved in our most prominent program, which you could say a little more about, which actually spans all levels of education in one single program.
So that we have this really wonderful program called the Climate Change Research Initiative. New York City Metro teachers, they embed themselves with our scientists every year. This program's been ongoing in its current form for, I think this is our 12th year. And before that, we had precursor programs, which I can tell you about later. But
it's award-winning at NASA.
It's one of the highest impact programs in all of NASA, because the high school teacher who works with us, he or she has two roles. One is to be an intern at NASA and really have that experience of doing like research, like figuring out the unknown, which is really a marvelous thing, not just for professional development, but also, I mean, I find doing research inspirational. And I hope that I impart that excitement onto the teachers who work with me. Now, New York City teachers, they have between 100 and 150 students that they see every single day. And so the teacher converts their experience as an intern into their day-to-day curricula with their students. And we are, things are aligned with New York State Regents. They're also aligned with the Next Generation Science Standards, which is the emergent, it's science has something different. It's not Common Core, it's newer, and it was developed in partnership between education specialists and scientists. And so they develop curricula. It's available freely for anyone, and it's published on our website. So if you want to have NGSS aligned climate change curricula, you can just come to our website. It's free. They do community outreach. Like we have a footprint of around 100,000 people in our program alone, which is something for a group such as us. We have, partnerships with all the informal education places, very tight connections with the Intrepid Museum, New York Hall of Science. There are other developing museums like the Climate Museum, which is kind of a moving museum and education piece, which is developed actually by folks with in our building. We are very intimately involved with community boards. Like one of our scientists, he actually does programs where they have people walking the streets and actually like quantifying like urban heat island. And he's worked in conjunction with the community boards, Christian Bernayan. I know he's definitely spoken at Community Board 12 to do walks across the community to see how the urban environment and how the heterogeneity of the surfaces in the urban environment can really have a big impact on urban heat island. So
a lot of internships, high school interns, college interns, master student interns all participate in the program that Allegra described with the teachers and the students.
Let me ask you. The fate of it now is that you have to move from where you are by when? That happened on Friday.
We were out by Wednesday. And so if you saw a big pile of trash on 112th and Broadway, that was our former.
And where will you work? Where will you go to?
We don't have a home currently.
We were just evicted.
We were
to go home and work.
But not fired, so it's a
Not
very
fired.
strange limbo.
Okay, because this administration seems to be very anti-science, even though they need the science. In addition, the problem is Elon Musk has his own thing that he wants to do in his contracts. So there's the competition. But still, what this resolution then asks for with the reestablishment, how would you, and we'll probably need to wrap up within 10 minutes, but I think we can, safely do that. With the reestablishment, where would you still be in CB9?
We very much want to come back to Community Board 9. We very much do. Like there's Columbia University, Barnard College, City College of New York, the multitude, we work with folks at the hospital and we work with folks at NYU. Like it's the central location of CB9. It is really the center of the academic community in New York City. And we very much want to come back and be here in this community.
Is there any space with them, or have you talked with them in terms of the possible reestablishment?
We are,
Although,
so it's early days, so we would like to be open to move into any kind of a space.
But there's no budget line item. The government, literally NASA was instructed by Doge to remove us from the building, cancel the lease, which they can't actually cancel, but
Right.
remove us from the building in 15 days. NASA told them it's gonna take us 30 days at least. So Doge said, fine, get them out in 30 days. And NASA committed itself to that activity, and we were basically told to couch surf. That means we're expecting, basically we're government workers expecting other people to pay to keep the lights on, at any sort of place. And at the moment, because roughly 70% of our, well, maybe 60% of our total 130 strong staff is employed through a joint institute with Columbia University. Columbia is providing some of that funding, but what will happen is that the overhead on those people will increase, because previously the federal government was covering that overhead. So, and part of the Doge point was that there would be no, that basically NASA would be forbidden from spending any money on our keeping the lights on for any space for us. So of course, meanwhile, it seems that NASA is expressing commitment to our expertise and what we bring to the agency. They're talking about a virtual institute. So we don't know what that is going to mean for us. Will it mean higher overheads at a minimum on a lot of our space? We just can't guess right now. And what is going to happen with the federal budget is going to make a pretty big difference, I think.
So wait, I'm sorry, because I stepped out, just to be clear, there's payment on a space that you were at,
Yes.
we saw you in New York, I saw you in New York, one not too long ago.
Oh, yeah,
So,
okay,
yeah,
great.
so-
Okay.
There's payment on the space where you're at now, but they're kicking you physically out. So you're paying, who's paying for the
Yes.
space?
You,
We are not,
me,
I
the
think that
taxpayer.
ultimately the taxpayer, but this is like 10 steps above my pay grade, but it's my understanding that the real estate agents pays, and then NASA pays the GSA,
Okay.
and then NASA pays GSA back. So somewhere along the line, someone will attempt to stop paying. Now, whether they try to not pay Columbia or GSA, or whether NASA attempts to not pay GSA, or whether the building continues to be paid for empty, I don't know. I don't know how that'll work.
legal, and is there any legal, I know everything's, really early, but is there some legal counseling? Because the pushback has been basically working, but it still takes time to push back.
So, wait, I'm sorry, logistically, I just was trying to understand.
It's
So
kind of
you guys there's a space being paid for, but you're not allowed to run a program.
correct.
So that's the
Correct.
first crazy thing.
Right.
The waste of
Mhm.
money right there.
Yes.
And then they don't want you to do the work you've been doing, engaging in the community and increasing awareness and.
My
Well, have you-
internship program was the first thing with the new administration that got canceled, unfortunately.
You're still working, you're still government.
I'm still
Yeah, we
working
haven't
as a
forgot
government
about
employee, but this summer, like normally I would be onboarding like college kids and high school
Right.
kids right now, but unfortunately,
And how
Uh,
many
there-
would that have been?
there was like one of the bad, the D's or E's or I's words in my internship program, so it is
Yeah,
done.
No, so how many students would you have been onboarding by now?
Typically in the summer, in the summer, we have, teams of 5, we have 6 teams of 5. So it's.
About 30.
Yeah.
So 30 for the summer.
As part of the STEM,
Have you engaged
STEM program.
representative SBI?
Adriano lives in my co-op, and so he is aware.
He's one of the ones that we send to when we send out, the resolution once it's voted on.
So he's aware, but what has he said?
We spoke, Johanny, his chief of staff, what's her last name? I'm so bad. It used to be Aneri Batista, but now Johanny's,
Garcia.
what is her last
We'll
name?
get it.
Yeah, I thought. Okay.
I'll have to look,
I don't
I'll have
know
to look
if
it
I
up,
have
but,
it.
she and Adriano, they, and Nia.
They seem favorable.
They are supportive of us. I think that there's a fire hose of other activities going on in the immigrant community
Yeah,
that
I
have
think
taken
that's what
higher
gets
priority.
attention, right.
Which I'm not,
It's got pressure on him with that.
I mean, that it's something that absolutely needs to be taken care of. What I can say is like for American science, like our institute draws from the greatest minds across the country and across the world. And many of those folks become your neighbors. Ann and Andy live here in your community. I happen to live uptown. I'm not from New York. Doing climate research was my dream, and I came to New York when I was 21 years old from West Texas, of all places. There are folks there from just about every continent, none from Antarctica, but there's the kind of research we do it. We're very much in partnership with the community. So I'm always surprised when folks say that.
Maybe it would be a good moment to read this, because
I actually worked on this, and I can put numbers, like there's a report about how much money, like having it at NASA Institute, like there's a multiplier that, so you can estimate like how much economic stimulation it does. Would you like me to read this aloud or?
It doesn't hurt to hear, but I'm trying to think in interest of time because Monica.
Is there, yeah, I think you covered a lot of the partnership activities. We're glad to read it if you'd like to hear it, but it basically goes into benefits of.
Edwin, is Edwin still on?
I don't see it. No. He gave up.
Isn't the gist of it though, that
Yeah, 'cause
NASA
he
tells
made
us
a couple
they're
recommendations
looking for a new home for us? And
Right.
this is part of us reaching out to the community and all this.
and making
public
an
education,
effort.
but also to have a statement saying, we want to be here in this community and this community wants us to be here.
Yes,
I think that's the essence of this.
Exactly
resolution.
right.
But see, you're looking for a new space to work, correct? That's what I'm hearing. Even if you're paying for a space that you can't be in,
Don't make sense.
right?
It's people upstairs. We don't know. We don't.
This is like about 17 levels above my pay grade.
No, I get it, but I just wanna make sure that people.
I
You can say it many, it's exactly.
Oh,
like
yeah.
How large was the staff?
130.
At this New York office?
Yes.
130 staff too.
We were 5 floors of the building.
That's what I was asking, how large is your space?
5 floors. So you know Tom's Diner.
I know.
I feel you, yeah.
It is a 7-story building. The
Yeah.
first
Tom's
story is
Restaurant.
retail, and the 4th story is the International Students Office of Columbia, and the rest of the building is NASA.
Yeah. That's so funny. I went to Columbia once again and I had no clue that you guys were there.
Well, if
So-
you
You were saying about that cool signal, like you see people, so it's so cool, we can't have one outside our building because people steal it. It's like, it's too nice of a logo. I mean, there are different theories of why, but it doesn't say NASA outside our building, right? So no one knows NASA is there.
Just, we have in terms of this, and I'm just moving it along, because I know Monica has agreed to stay. She's also vice chair of the board to help close up. I mean, I'll stay if you won't be by
Monique.
yourself. I said Monica did. Monique.
Monica was on.
Yeah, Monique. And so let me just ask a couple of questions. I believe we're in favor of this.
Yeah.
Actually, we could do that vote right now. All those in favor, hopefully you had a chance to read and that's, we can make suggestions and, change. I know you got favorable response. What do you think, Heather? What's your thinking on? Because the whole thing is. That's right. So, let's see, the committee members, so, we have a quorum, and so what would happen now is that it would go to the executive board, which meets this Thursday. And, the executive board would just vote to pass it to the general board. And it's the general board that would vote on it, and then that's when it has legs and starts to move around and people begin, those who can make a decision. Who, other than, our political, elected officials would be instrumental. Sometimes, what other departments, that work for here or have to, who should see this, resolution?
I mean, the electeds, I think is a great place to start at all the city, state and federal elected.
Could you get us any additional names, because that gives us at least,
Name do you need?
well, and we send to everybody.
Okay.
Whether they're, minor player, minor role, 'cause you never know who becomes a major player, and all of this.
Outreach group.
No, we do have the outreach.
Maybe we're organizing. We have been organizing
I mean-
intensively ever since this attack, basically.
Have any employees been let go?
So, I mean, the
Not
way
by
that,
NASA.
the,
Yeah.
Wait,
The way
so
that
not
funding-
from
so-
NASA,
so the way that,
but that includes
so
you guys.
you
though,
guys
right?
may
I
have
don't
seen,
think Columbia either, but Columbia's under.
but, you may have seen the news about NIH and like overheads and like this kind of obscure thing. What you may not know is that this is the way the entirety of American science works this way.
Oh.
So, us in the building, like all the Columbia employees are on what you would call as soft money, which means that they write competitive research grants that mean that, have a funding rate of around 10%. And that's how they get their funding. And those grants are, the pot of money in the latest budget is basically half of what it used to be. And many grants are actively being canceled. Not just at the NIH, which you probably have heard about, but at also like NSF, the National Science Foundation, Department of Energy, EPA, like there's many different science facets that have these grants that are being canceled. So when you can't raise your own money,
Right.
you can get fined.
Yeah, what I was gonna ask you is, you say you have different offices throughout the nation, right?
So the closest NASA office is in Greenbelt, Maryland. That's
Right.
like, around 200 miles from here.
But they're experiencing similar cuts, correct? Or
They
they?
did not get kicked out of their building though.
Okay, and that's what I was asking. I mean, is the administration specifically targeting your office, this particular office, because we are the woke state?
I mean,
yeah.
I would say that what they told us is no, but there are two C words that we are invested in, which is Columbia and Climate.
Yeah.
Okay, Heather, what did you say?
Yeah, she heard me.
Okay, now, who at
Yeah.
Columbia should get a letter
Sharon
showing?
Sputz.
Can you, I'll write down Sharon Sputz, SPUTZ,
She's the research, what is her?
I haven't been.
and of course, I would think the president of Columbia University.
This is a moving ship.
It is. I mean, who is it, Claire Shipman or whatever?
Uh-huh.
Yes.
And we need anyone that you think has influence, or carry some weight, or even if they don't have, if they're between a rock and a hard place with Trump, Doge, then at least they will show that they have support for your organization. That's important. too.
So maybe we can.
And yeah, maybe, I don't know.
New York State Republican.
I mean, I talked to Lieutenant Governor Delgado a couple weeks ago about his staff's been very.
Anthony, I thought he left.
You mean the lieutenant?
He's been
Well,
going, he's been going around doing town halls all over the city, actually.
Okay,
Well, got-
yeah, Anthony
So,
Delgado.
like the
He's
governor's
supposed to be
office,
doing
I
it.
mean,
She's not been
Yeah,
very
but you need.
helpful.
like she just, they don't really, you call and leave messages and
Who
you
is
don't
this?
know. where it
Hopeful.
goes.
Yeah, that's just not, I'm sorry.
Wow.
Yeah, but she's juggling too with those people.
Influencers who support NASA.
Say that again, Heather?
Some Republican influencers.
Right, I'm trying to think who that might be, somebody who might.
Lawler maybe, but he's
Yeah.
Long
You think
Island,
Lawler?
but still.
There was
Lawler.
Gillibrand's office, right?
Yes.
Oh, Kirsten
They were
Gillibrand, yeah.
Gillibrand's office.
She's both sides of the aisle or something.
Chuck Schumer?
We've tried to call Chuck Schumer, he's never called me back in all these years he's been my senator.
Really?
But sometimes it's their chief of staff or their key person.
That's what I was thinking.
Yeah, because they are, they
Federal
really are.
senators.
But I think it could be their chief of staff that who's really
I
very
think-
powerful.
I want to say, I mean, this, like, although I'm not from New York, I am from flyover country.
Yes.
And NASA and its programs let me become a scientist at NASA.
That's right.
And I try, I may not be a trailblazer, but I try very hard to be a path paver and make it easier for folks who want to get into science to become scientists themselves.
Do you still have family members in Texas?
I absolutely do.
Well, then that's.
And they're in Sylvester Furnace District.
Yeah, let's make sure the Texas NASA gets this. But Lyndon she mentioned Lyndon Johnson.
Johnson Space Center is the Houston thing.
Yeah.
And there's a.
You should use your background from Texas.
Yes,
Yeah,
but you would
because
believe
she's
it.
here though,
No,
so.
it doesn't matter.
No, it does, because they're petty.
Exactly, that's why she has to, but if you don't wanna reach out to get Republican representatives.
We could put,
Personal time, I do take my days off and I do that thing on my personal time, just to be clear.
We could put them in the, because this resolution is coming from us.
Yes.
Correct, we just need to know who you
So
think are key, in addition to who we
let's
think are
bring a
key.
list, Allegra,
I'll
let's,
put a
Right.
list.
we're having a meeting on Wednesday.
Right.
That would be a
Well,
great
I'll come up
opportunity. We're making our own database as we speak pretty much, and we can supply that to you. Is there a timeline?
And we don't
which
need
you
all the
it?
names, just your
Thursday.
top.
This Thursday?
Today's Thursday.
Okay,
Our
good. So
meeting is
we'll
the-
get it.
Your
to you
top,
Friday.
and not the list, if you
Not
could
this
have,
Thursday, next Thursday.
so we don't have to retype, you
Yeah.
know,
Yeah.
Yes.
because Ashley will
Yes.
probably be the one doing this, and we have so much stuff that has to go out.
Yes.
So if you send it to us, it doesn't have to be your entire list, just key people, and I.
Let's alert tonight
a
about that.
couple of Texas.
I have another quick question as well, in terms of different partners to bring. I mean, obviously you're doing academic work, and you said you're engaged with many of the
The local.
students. I'm thinking students, I'm assuming a lot of your students are coming from CB9, but maybe not solely.
Sometimes our students come from CV9, but typically our internship, because we don't have a budget for housing. So typically they're people who can commute to Community Board 9 every day. So it's not always people who live here, but
We
it's
need to
always
have
people who
some
commute.
community board.
Right.
I would love to have.
Because that's my thing, to strengthen our position in terms of advocating for the resolution. I was gonna ask you how many students are from CB9 people from CB9 are participating
Or
in the
you
program.
commit to a certain percentage.
Right.
Because you are located, right now you're located here, and Columbia's here, and, well, City College is here also.
Ask Matt.
Yeah, let me get that, because I think there's more than I know about, because we have like this best teachers program. Like our education officer is really, really wonderful, and we do a lot lot
Is
A
this
lot.
something?
Okay,
that you would
I don't
need by
doubt
Thursday?
that.
Some information
We
by
have
Thursday?
more time, once the resolution is approved,
Okay,
then, from now to general board meeting is, about 10 days.
okay. So that's about how long we have to get all of the names, and
Yes,
also. we
after
could
it's
get some-
voted on, we wanna send it out right away, and so in this
Okay.
office, they'll say, who does it go to, and it would be great to just have the list already
I'll
done.
get that.
And it gets emailed, it's done by email.
Okay, and we can specifically ask about the CB9 participation in our programs, and we'll ask Matt.
It would be nice to add that.
Yeah, that would
Well,
help.
also, just having an office here is also important, because you're employing people and,
Right,
you know,
that too.
the
A
activities.
good many of us
opportunities,
actually live
programs.
in
Quite a
CB9.
few
Our
folks.
co-op alone houses about 10 maybe.
Yeah.
And that's great. I mean, once again, as a community board, we can push that for sure, because I know that's gonna be the question. I mean, I'm asking that. I didn't know that you guys were here, but I'm very proud that you are. But I know other people on the board will ask, I mean, they're not on here now, that's why. But, and even Wendy is on there, and she works with young people, and they're
Yeah,
always.
Wendy has approached, she's also a grantee from, West Harlem Development Corporation, which CB9 really helped establish with Columbia.
Right. So, I mean, we definitely have to, we'll do our best to keep this jewel here. That's another thing that makes
I
CB9
just wish we
unique.
had known,
We did-
sooner,
we
it
did-
wouldn't have stopped them.
It wouldn't
They
have.
would be,
We-
they were
yeah.
determined, they have other motives.
I came to the first community board.
Correct.
I didn't quite make the health committee, but this happened so fast.
It did.
So fast.
but it's health and environment, so that's where.
Yes, yes,
Call
yes,
it.
yes.
And I'm sorry, and I was thinking about the youth and education committee, you know, working with them as well,
Mhm.
which is why I mentioned about the student participation from CB9.
Something to know, just from the perspective of outreach, is that NASA has reorganized its STEM, engagement in a way that's been detrimental in time, and with several reorganizations, and so
Before
Allegra
this
has had.
administration came on board.
Yes, and so Allegra has had, and that has to do with, as I mentioned earlier, in real dollars, NASA budgets are actually declining, if anything, for earth science. And so that's affecting our space missions, and when it starts affecting our space missions, one of the first things to get cut are these education programs. So Allegra has been, working, heroically to try to keep some, including some foundation money, I think, that you brought in, Allegra. So, but it's been a really difficult environment, and we aren't really, this is outside of our own time in a lot of cases,
Right.
and we're
And that's what a lot
realizing.
of people are doing.
Absolutely.
Pushback.
Absolutely.
Oh, yeah.
That's
Yeah.
the issue.
You're right.
Yeah. What's that?
I said, because NASA is competing with Elon Musk and his mission.
Oh, yeah.
That's what the problem is.
Right.
So, are there any students who, were coming from somewhere else who missed out on their internship because of the
I mean,
cuts?
they were all canceled, a whole bunch
The
of.
summer,
Right, but I'm
the
saying,
summer,
did
we're
any
not,
come
not
from
any
Republican
interns.
states, or are there any students who can
From
write
their
letters to
states.
their representatives
So
saying
the-
they missed out on this
there were a bunch of-
opportunity?
The one silver lining of COVID was that we started doing a lot more, we allowed virtual internships instead of being in person. Which meant that we were able to tap into kids from all over the country.
Yeah,
Right,
so those
understood.
students who missed out on internship opportunities, who may be coming from red
Well,
states,
I mean,
we should engage them to write to their representatives.
should say, so we would have chosen you if only we'd had. I mean.
It might get
I would feel
tricky,
awkward
but-
writing that.
Yeah, it might get tricky, but if you get
We would have
staff.
chosen you.
Well,
You get the
so
staff.
we're working all sorts of angles, but
Well, yeah.
your vote, and your resolution really matters to us.
Yeah.
And so I just want to
I-
underline that.
I mean, I think
What's
it's.
Microsoft? I know they're heavily involved in more of the medical than environmental, but at some point they merged, but the two.
No one wants to attract attention from Doge for protecting something that they're trying to take out right now at the level of Microsoft.
Right, so they're not
it's-
gonna.
It's very difficult,
put
but I
themselves
would
out
say
there.
They
if,
say
Do you need
Bill
help?
Gates
No.
has been good, kind of like
Well,
sipping.
So we're,
around.
all
Yeah.
avenues are open in terms of like investigating a way that we can keep doing our mission. It's super. Sorry, I have to leave.
Heather, thank you, we'll talk.
It's unprecedented, like knowing like what path to forge here. As civil servants, like, the rules that rank and file civil service, we really try to follow the rules, so like in going for the, private foundation money is a little bit antithetical for the way the civil service and our federal agencies are supposed to be funded.
Right.
Uh,
Yeah. So here's what, we'll get the list from you in terms of
Yes.
who you think should get this. And it doesn't have to be 1 million people, it could be 10 of your top.
Okay.
Or, people.
Yes.
And,
Yeah, and if you're.
and the
able-
legislators.
Well, and I would go back to, in terms of your efforts to reach out here locally, because that just strengthens the and us
Mhm.
presenting the resolution.
Mm-hmm.
Your outreach here, if you're able to tell us how many people from here were able to participate.
yes, we will
Absolutely
definitely follow up on
with
that.
that, and
Yes.
so.
And
And
then
there-
we'll have
you
to-
have
I want,
people
it's
like me-
8:57, I wanna close
Let's
before
put
9
that,
o'clock.
but I mean, Heather knows me, like, I go to your transportation meeting here in community board
Oh,
9, they all
solid.
know me, yes.
You're so
I'm-
you're so like innocuous and you're working in this, I'm just like so floored.
I don't normally, I feel like tooting my own horn if I say NASA, but,
But,
we love being here and we love this community.
I love
love-
it, and
we
we
love
loved
it.
it when we heard it, and then like,
I know.
and I fell in love with
Yeah.
it and hearing it. and
Like I said,
yeah.
I was next to Victor, I was laughing, I said, NASA's in our backyard. be possible? We don't know about that. That's insane.
So let's talk, I know Edwin had some, he liked this resolution, he had some, he said minor, modifications.
Yeah.
So I'll incorporate those and hopefully they
Yeah.
match.
I didn't get to
Makes
read it,
sense.
so I will read it as well.
But we're
It's
for,
not, yeah, it's not laborious in terms of, you know.
Feedback welcomes, right?
Yes,
Like, right,
yes,
you know,
yes.
we're glad to
I was
discuss.
going to get back to her, but it, you know, it's better having the group here, and I
Yeah.
did, you know, reach out to, I know everyone has helped with a number of resolutions.
Well, we're
actually.
very glad to discuss, so.
Thank you, yeah.
So please
I
don't
need-
hesitate.
If you, when you get a chance, email.
I forwarded your email to them, but I will CC
Yes,
next time.
So I
if you
have their
everybody.
emails
Yes.
and.
So wait,
Phone number too.
so let's end the meeting, we can wrap up with them, what, we wanna end the meeting and officially say it's, it's been.
8:59,
Yeah.
or is it 8:58? What is it?
Well, I like to say it's
8:59.
8:59.
Okay.
Okay.
And let me just make sure I write it down. Sometimes I don't get, we always forget to have